Hello everyone, welcome to Texture Myth. In this session, we are going to talk about another very important topic related to medical coding, and that is related to anatomical terms of direction. So by the end of this session, you will be able to understand what are anatomical terms of direction, why it is important to talk about and learn about anatomical terms of direction, and also we will try to understand some of the key concepts that every medical expert should know about anatomical terms of direction. Okay, so these all things we are going to discuss in this particular session, but before we get started with it, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on what are anatomical terms of direction. But prior to that, you should know about other important stuff that we have already covered, and for that you can also refer the Texture Myth digital course book, which is freely available for all of you in the description box. There you will find more than thousands of videos available in both Hindi as well as English language. So without any language barrier, you can easily consume the content, and there you will find one particular tab for medical coding where you will find all the related stuff. Okay, and in case if you have any questions over there, you can simply reach out to me. I will through comment section, I'll try my best to answer all your queries. Okay, alright, so let's get started. So here you can see we have first question, like what are anatomical terms of direction. So we will proceed in the same way. Firstly, I'll explain you the theoretical things, and at the end I'll provide you some questions that are very important for the job and interview purpose. Okay, so let's see how it goes. So firstly, we will start with the definition itself, like what is exactly the anatomical terms of direction. So if someone asks you in interview what are anatomical terms of direction, so you can simply say that it is like anatomical terms of direction are specific standard word used in anatomy and medicine to describe the exact location, position and relationship of one body part to another one. Okay, so here, like, these are very simple concept that you have to tell them, the interviewer, that these are some standard word that are used in anatomy and medical science to describe the exact location, position and relationship of one body part to the another. Okay, and in a very simple terms, you can say these are the special medical words that tells us where something is located in the body compared to something else. Okay, so I think with these two simple definition, it is quite clear like what is anatomical terms of direction. Now once we know what are anatomical terms of direction, the next thing is what are the, like, why it is so important for us, why are these terms necessary for us. Okay, so let's talk about in a very simple way. So here you can see in a notes I have noted down, in every language we use words like up, down, in front, behind, right? But these words can be confusing in medical science, because sometimes a patient can be lying down, sometimes standing up, or sometimes upside down. So in this situation, we can't just simply use these words like it is upside, it is downside, it is front side or behind, right? Second thing is, two doctors from the different countries may use different everyday words, right? Let's say if we are talking about India, the doctors are using some different words, but in compared to other countries, like, they are using other words, right? So there would be a lot of confusion because everyone is using their own terms and words. So just to remove that confusion, we should know about a common anatomical terms of direction that will be utilized universally. Okay, so that is the second reason for learning the anatomical terms of direction. Third thing, in surgery and medical coding, even a small mistake in location can cause a serious errors. So that is also true, because let's say if only one word is got changed somehow, so it will impact the entire process, right? Whether it's a surgery procedure or it's a medical coding profile work, right? Everything will be changed because of that one single word error. Okay, so we can simply say that anatomy uses a universal standard language that means the same thing everywhere in the world in every situation. Okay, so just to avoid these kind of issues, we should know about common anatomical terms of direction, which is nothing but a standard words that are used in anatomy to describe the exact location, position, relationship of one body part with another one. Clear? So I think with this it is clear now, like what are anatomical terms of direction and why it is important for us to learn. Now the next thing is the foundation. Although we have discussed this thing in our previous session, anatomical position, but it is the core foundation of all directional terms, right? That's why I'm just going to recap it in a quick way. So here you can see all anatomical terms of direction are only meaningful when the body is in the anatomical position. Okay, so this is the first prerequisite. Now those who don't know about position means, like anatomical position means, then you can simply read this statement that body is standing upright and straight, face is looking forward, both arms are at the side of the body, palm of the hands are facing forward, both feet are flat and on the ground pointing forward. So if body is in these kind of position, then we can say that it is an anatomical position. Okay, so we can say that this is the universal reference position. No matter how the patient is actually positioned, all directional terms always refer back to the anatomical position. Clear? So firstly we know about, like, firstly we learned about the position. Now we talked about the directional term. So now you know how to refer anything in a body. Clear? Fine. Now the next thing is the core concept, the key concept. This is very important. So here you can see I have clearly mentioned these are the relative terms. Okay, anatomical terms of direction are the relative terms. That means anatomical directional terms are relative, not absolute. This means they always describe the position of one structure in comparison to the another one. Okay, so it is used in relative manner. So if you are talking about one body structure, then you have to compare it with the another one, then only things would be clear. So let's see some example of it. So you cannot just simply say that the heart is the anterior, because it is an incomplete thing. We are not supposed to guess the things, right? So here we cannot say that the heart is anterior. Instead of that, you must say the heart is anterior to the spine. Now once you say this entire statement, the heart is anterior to the spine, it is quite clear, like where is heart located, where is spine located. Clear? Similarly, you cannot say the knee is inferior. Instead of that, you must say the knee is inferior to the hip. So again, here we can clearly understand the exact location of both the structure. Okay, and that is why we are saying that it is a relative term. So here we have noted down one structure can be both anterior and posterior at the same time, anterior to one structure and posterior to the another structure. This is very important line. So always remember this, that one body structure can be both anterior of one or posterior of one, okay, at the same time, because it is possible that one structure anterior to the one structure and posterior to the another one. Okay, so always remember this this key concept, that it is relative, and it is also like one structure can be both anterior and posterior. If you don't know what is anterior and posterior, don't worry, these are terms that I'll explain you in the upcoming session. We will discuss it in a very detailed manner, but for now just keep it in mind that what we are talking about is just a key concept. Okay, now whatever terms are there, every anatomical directional terms has a opposite term also. Okay, so they always come in the pair. Now let's see what all most frequently used pairs are there for the terms. So first one is anterior ventral, that is, and the opposite term is posterior dorsal. Similarly, superior inferior, medial lateral, proximal distal, superficial deep, ipsilateral contralateral, bilateral, unilateral. So these are some of the pairs that frequently used together in order to explain some structure of the body. Okay, and if we talk about the overall terms, so these are the overall terms that we are going to discuss in the upcoming sessions in detail. But prior to that, we will also learn more things about this directional term. Okay, so yeah, that's all for today. And as I mentioned, like I'm going to share you one very important question. The question is, what are the major body regions? Okay, so I'm sure you already know the answer of this question. So if you know the answer, please do share your knowledge in the comment section by answering this question, so that those who don't know, they can directly refer your answer from the comment section. In case if you don't know the answer, then you can refer one of the previous session where we have already discussed this question in detailed way. So from there you can learn the concept, and then you can share your knowledge in the comment of this session. Okay, answering these questions will instruct me that yes, these sessions are helping you out, and then in that case I will create more and more sessions. As many comment we will receive in terms of answers, accordingly like we will publish the sessions here. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching TechSharman.